Hello everyone, welcome home. Happy Wednesday, halfway through the week, almost there at the weekend. Stay strong. It is so good to have you with me on this day. Thank you for taking the time out to hang out and get up to speed with everything that's happening on the continent when it comes to this coronavirus pandemic. On this Wednesday, we're going to do things a little bit differently around here. We are going to take a deep dive. And by that, I mean we have just one guest in the house, one guest to spend time with and have an in-depth conversation about the pandemic, about the virus itself, about the conditions around it, about what's happening. We're going to do this every Wednesday. We're going to have a doctor in the house. We're going to have an accomplished mind, someone to go deep into the science and really bring out the facts for us and answer your questions. So if you have questions that you'd like us to put to our guest, Dr. Ishira Blazer, who will be with us shortly, please start sending them in now. Anything you want to know about where things stand with this virus, with this pandemic, with the science, the headlines that we've seen in the last few days, get writing. You know how that works. Just send in your questions and we will put them to Dr. Blazer. Also on today's show, you may have missed a special conversation I had yesterday on Instagram with the wonderful Jackie Appiah, one of Ghana's most loved actresses. We're going to bring you a little taste of that. It was a fun time and we think you should see it once more. And that, and of course, just a full check of what's happening on the continent. We have it all for you right here on Home with Isha Sesay. Let's get started. All right, only one place to start, and that would be to check the numbers on the continent now in terms of what is happening when it comes to the spread of coronavirus. Let's bring those numbers up. The one thing I can say for certain is that it is not slowing down the spread of cases. The numbers are moving in the wrong direction. Currently, right now in Africa, the numbers have gone past that 50,000 mark. Look at those numbers on your screen right now, 50,574. Those numbers coming to us courtesy of Johns Hopkins University. They are collating all the data. 50,560. In fact, it's moved up since I wrote it down. So it's 50,574 on your screens. Active cases right now, 31,725, and look at the number of deaths approaching that 2,000 mark, 1,946. We continue to look at the situation carefully. If you look at the north, you look at the south, countries there leading the way in terms of case numbers. Egypt with a huge number of cases, over 7,000. South Africa as well, over 7,000 cases. We should keep an eye on that Northern Africa region, because we talked about Egypt, over 7,000. Morocco has over 5,000 cases, also 5,382. Neighboring Algeria, 4,997. Northern Africa, definitely with a big glut of cases. In sub-Saharan Africa, we continue to watch closely the situation in Ghana, 2,719 cases in Ghana. Nigeria as well. I think you, if you were watching the show yesterday, you would have heard me say that the numbers in Nigeria are moving fast. Lagos continues to be the epicenter. Nigeria, 2,950 cases. And let's run through them quickly, because when you look at Senegal, Ivory Coast, Guinea, all of them over 1,000 cases. Senegal, 1,433. Ivory Coast, 1,464. Guinea, 1,811. And to the east, we look closely at Somalia, where the mayor of Mogadishu is warning that coronavirus could overtake the country. 873 cases there. So we start this show every day by giving you a check of the numbers, so you have some sense of what is happening and you get some sense of the spread. And it is spreading. It is not slowing down. So we can't take our eye off this. All right. Pandemic That's the word we're all talking about day and night. It's the one thing that's the top of mind, this coronavirus pandemic, how it is moving through populations, how this virus does not care whether you're rich or poor, whether you're European or African. It is no respecter of status. It is moving through the world and moving through quickly. As it moves, it is also raising a lot of questions that we are still struggling to answer. And so every Wednesday, as I said at the top, we're going to bring in someone of great note, someone who is looking at the situation more closely than most and get their perspective on what is playing out. Today we have with us Dr. Ashira Blazer. She is assistant professor at the New York University School of Medicine, where she focuses on rheumatology. I am so glad she's taking time out to answer your questions and my own. Dr. Blazer, welcome.
Thank you. Thank you for having me.
It is great to have you with us. Let us just start by, getting a sense of what is happening right now here in the United States. And really, we start there so that maybe for our viewers who are watching us, in Africa, they can draw lessons, if there are lessons to be taken, in terms of how we approach this on the continent. Here we are. It's Wednesday. We are looking at close to 40 states here in the US opening shortly. And at the same time, the case numbers continue to surge. The hotspots continue to pop up everywhere. Talk to me about what you are seeing, what stands out for you, and what the lessons are here as we look at how the US is responding to this.
Yeah, so the U.S. actually does not have a very coordinated response at the moment. You have to sort of think about it in region. It's very regional. So, for example, I'm in New York City, and we've been the epicenter. And like in Lagos, this is a very populated city, a place where a lot of people are going to be in close contact with each other. So we sort of expected that to be the case. That said, we've had a lot of coordination in our state government with Governor Cuomo, a lot of the scientists who are involved in this, public policy makers, things like that. And so I think that the response has been very orchestrated in this neck of the woods. And so I think that, we've been looking at the rise of cases, the lagging indication, which is the rise of deaths, the fall of cases, and then have a very clear plan as to when it's safe to open up. The other thing that I think we've done in New York is try to support the population. So I think the only way, once you've got wide community spread of this virus, the only way that you're going to prevent death and overcrowding in hospitals is to have people be able to stay inside and stay away from each other, social distance. However, people have to be able to afford that. Staying home means not working. And a lot of people who don't have a cushion cannot afford to not work. I think in New York, and better yet in some other countries, there have been a lot of social support initiatives to try and make sure that people aren't feeling so much pain. That has not necessarily been the case in all of the country. Testing has lagged in a lot of the parts of the country, and there have been a ton of protests about, people saying, I can't afford to not work. I don't have enough of a cushion for this. We don't have support for this. And so there's been a lot of pushback.
And it really drives home, I think, for African leaders, just how difficult this is. Not that they need another example, they can see it right there within their own borders, but when you see the US struggling with testing, when you see the US struggling with contact tracing, it just really drives home how much of a monumental lift this is to get the situation under control.
Yeah, for sure. And I think the other thing that we have to think about is this is a global pandemic that has moved incredibly quickly. So it's not just about whether or not you can get the reagents in your country. It's that you're competing with the entire world for the same reagents, the same supplies, everything. And so even here in the United States, states are at a bidding war with each other for not just tests, but for respirators, for equipment to take care of patients, right?
And I want to ask you about that issue of reagents, because Africa has struggled. We had the head of Africa CDC on the program on Monday, and one of the things that Dr. John Nkengasong has said freely, widely, often is that Africa has been shoved out of the diagnostics market, and that we are just not able to get our hands on the tests. And then there's a question of the reagents and all the rest of it. Is it just a supply chain issue, as you understand it from where you sit and you're looking at it? Is it that the stuff is only coming out of China? Is it not being mass produced in other places and they just can't get it out because air traffic has been snarled? I mean, why is it so difficult to get our hands on these reagents and the other elements needed for testing?
Yeah, I mean, I think it's all of the above, honestly. I think, under normal circumstances, we don't need this volume of reagents. There's not a situation where we need to be able to test entire populations of large swaths of the world for anything. And so, it's not like these things are being stockpiled. So not only will different companies in different countries have to ramp up production, but also you have to have the people to do the work, you have to have the means of transport, and really, because it's like any scarce resource, it's going to go to the highest bidder, right? And so countries with higher GDPs are going to have more buying power. So, and we know even in the higher income countries, there's a lot of difficulty with getting these scarce resources. So I can imagine that in a lot of sub-Saharan African countries, it can be even more challenging.
Yeah, indeed. Let's talk about the virus itself and what it does to the body. Give me your sense of how it attacks the body and the principal organs that it is really breaking down, or certainly mounting a huge fight against. Because again, people are still trying to fully understand how does SARS-CoV-2, which is the formal scientific name for this virus, how does it injure the body, and why is its reach so broad in the body?
Yeah, so I think there are so many questions about this, and this virus is quite unique in the sense of pathogenesis. So my first experience with patients who had this virus was, over 4 or 6 months ago, when I was actually doing duty at one of the hospitals here. And the interesting thing is, so this is it's a SARS, so it's SARS-CoV-2, right? So SARS stands for severe, acute, so happening pretty quickly, respiratory disorder syndrome, right? So it's a syndrome that's going to affect the lungs very quickly, very severely. So we have other viruses that cause ARDS, right? And we expected to be able to treat these patients the same way as we treated other patients who had maybe ARDS due to the flu or ARDS due to other viruses. But this one is a little bit different because so usually when you have this ARDS type picture, you have too much fluid in the lungs and then a little inflammation in the lungs, right? And so you can push past that by putting someone on a respirator and being able to breathe for them until their lungs are able to heal. In this virus, it seems that there are two other components. So there's a component of collapse of the lung, and then there's a component of sludging, like blood flow problem. Okay, so I'll sort of back up a little bit. If you think of the lung as, so think of the structure of a tree, right? So you have like the trunk of the tree. So the lung would be an inside out, upside down tree, right? So you're breathing in through your nose, and it's going to go into smaller and smaller and smaller and smaller passageways, like the branches of the tree sort of branch out. And then when you get to the leaves, the thing that's akin to that is this thing called alveoli, right? So it's like a sac that has a very thin and delicate barrier. And those sacs are there to be able to take the oxygen that you breathed in and then put it into the blood system. So just opposite to every alveolar sac is a teeny, very delicate blood vessel, right? So what we're seeing in SARS-CoV-2 is that not only is that alveolus, that sac, filling up with fluid, but some of them are actually collapsing on themselves. Oh, wow. And then on the opposite side of that, those teeny blood vessels that are supposed to receive the oxygen actually become clotted off. So blood clots are filling these vessels, right? And so now it's not just that you aren't able to get oxygen into lungs or into those little alveoli. It's that once you get oxygen where you need it to go, it's not going to transfer into the blood because a lot of these blood vessels are clotted off. And I think that's something that nobody really expected. And we're getting more and more information about the clotting, this pro-coagulative state. So the clotting that people who have this virus are developing. Yeah.
And I mean, I know that it's a novel coronavirus. It's never been seen before. That's why it's a novel coronavirus. But these elements that are in play, have we seen this before? I mean, not to the full packaging, but this that you're talking about, this clotting.
Yeah. So not exactly like this. I mean, it's just the syndrome is different than what we've seen before and different than what we see in other illnesses. The other thing is that it's a very multi-organ system disease. So, we think about the lungs, and certainly people who have this have very extensive lung injury. But there are a number of other organs that are involved, namely the heart, the liver, and then what we're seeing is, so whenever you get sick with anything, flu, malaria, part of the reason why you feel bad is because whatever's infecting you is injuring your tissues. But the other reason why you feel bad is because your immune system becomes activated. So whenever your immune system that's trying to fight the virus gets ramped up and very, very activated, it's going to produce different chemicals that are going to cause you to have, fevers, chills, shakes. But those chemicals,
which is your body fighting, basically.
But it's your body fighting, exactly. Those chemicals can also directly injure your tissues. So what we're seeing also in this disease is that the immune reaction is so potent that you end up causing injury to yourself. Wow. And so that's another facet of this that I think is a little bit different than other viral infections.
So let me ask you, as you lay out, we've talked about the heart, we've talked about the accelerated, almost potentially harmful, overactive immune response that your body generates, which can be damaging in of itself. Then, it's emerged that it can affect your kidneys. We've seen people experience renal failure. We've also seen injury to the brain, inflammation of the brain. I mean, as a scientist, as you talk to your other medical friends, I mean, are you scared? I mean, I say this not to be facetious or flippant, but this thing is just showing in so many ways. To us as lay people on the outside, it's scary. And I'm wondering what emotion it provokes in you guys.
Yeah, so the interesting thing is, I'm a rheumatologist by training. And I actually have done work on the continent in lupus, and it's Lupus Awareness Month, so shout out to my lupus patients. That said, so I understand multi-organ system inflammation because this is what I do all the time. So it's sort of like in lupus. Lupus is a disease. It's an autoimmune disease. The immune system becomes activated, and white blood cells are just members of all blood cells. So anywhere the blood can go, lupus can go, right? And so we see all these manifestations where they get lung injury, they get kidney injury, they get blood, brain, and it's very confusing until you understand the mechanism. It's interesting how similar this is to the multi-organ system autoimmune syndromes that I'm used to treating. Because, again, there's this component of immune activation and overactivation of the immune system. So yes, it's scary, it's unpredictable, but the other thing to remember is that most people don't get this sick. Some people get this sick. So
we know why some people get sicker than others.
No. That's the other thing that's really difficult. We don't know why some people get sicker than others. We know there's a component of age. We know there's a component of chronic illness. But also there's probably a difference in the way certain people's immune systems respond versus others. And I think that's the piece that there's going to be a lot of science on trying to figure out what are the host factors that make someone get sick.
What are your thoughts on what has emerged so far about trials of remdesivir?
Yeah, so I think, so remdesivir...
Sorry, let me just attribute it to Isaac Kyle, who asked me to ask you that. Isaac, thank you for the question. I just want to give it full attribution.
Sure. Yeah. Remdesivir is actually pretty promising. It had been used fairly regularly in the U.S. But only for compassionate use. So you could, if somebody was very ill, you could write into, I think Gilead is the one that's producing that, and ask for the drug. But there was a formal trial, and the results were pretty promising. So the duration of disease was shorter for people who got remdesivir, so they recovered in about 11 days on average. People who had been on invasive mechanical ventilation were able to get off the ventilator. There's some signal for decrease this immune response, and it was a sort of, whether or not it actually decreased viral replication was less clear, but there was some signal that could be the case as well. So I think that many of us are thinking that remdesivir is going to be more standard of care as we start to look for drugs that are specific for this illness.
And just to be clear, remdesivir would fall under the category of a therapeutic treatment because it doesn't cure it, right? It just helps you get better sooner.
Exactly.
Right.
It's an antiviral. It was actually developed for Ebola. So it's interesting because it had this orphan drug status because for Ebola, it actually was not approved. It did not show efficacy. But there was some indication in vivo where you could treat cells in a dish that were infected with SARS-CoV-2 and show that there's decreased viral replication. And so this is how the idea for repurposing this drug for this virus came about, and it appears to be promising.
You talked about, when we touched on it briefly, the question of why some people get sicker than others. Can you talk about the racial differences?
Yeah.
So in terms of infection, can you break that down for us?
That is a huge issue here in the United States. And I think when you overlay some of the things that we're seeing in the U.S. onto a global population, I think that we're going to see this in other vulnerable groups. So, we talk about this pandemic, and it is a true pandemic, but there are also a number of other epidemics that were already ongoing before this happened, right? So there was the, asthma epidemic in the U.S., diabetes, obesity, and we know that all of these chronic illnesses affect minority populations more. So when we're talking about a virus and who it's going to cause more harm to, we talk about differences in exposure, we talk about differences in susceptibility, and then differences in response, right? Exposures are going to be higher anytime you have people who are crowded together, anytime you have people who can't, take a single car somewhere, right? We find minority populations in the U.S. use a lot more public transportation, live in more crowded conditions, are more likely to live in apartment buildings, group homing, things like that, right? And so now you're going to get more contact with people. So people are going to get infected more often. And then on top of that, you already have a population that's relatively more ill than other populations. So more chronic conditions. So, where somebody who's healthier may come to this virus with a fighting chance to just get over it, somebody who's already chronically ill is fighting their asthma, they're fighting their hypertension, they're fighting their heart disease. And oh, by the way, here's this coronavirus too. Right. So those people are going to be more susceptible to having severe disease. We are seeing huge disparities in the U.S. Some cities like New Orleans, where 30% of the population is African American, finding 70% of the deaths are African American. So I think we need to keep an eye on all vulnerable populations around the world to make sure that we're concentrating efforts where they're most needed. Knowing
the knowing the inherent conditions that exist in vulnerable populations, and as you said, the pre-existing conditions that make it so much harder to fight this. If you are an African leader, an African decision maker, is there anything you can do? I mean, apart from the obvious, which is to, try and break the chain of transmission. Are there any other steps you can take in terms of preventive steps to kind of fight this? Because you know that your population is inherently vulnerable in many parts of the continent.
Sure, yeah. I think education has to be a huge part of it. And one of the things that's so heartbreaking to me with regard to this virus is that there's so much misinformation. And the same populations that are ill because there's been structural racism, right? So these populations are primed for not trusting because institutions have not been trustworthy to them, right? And so misinformation is going to be especially damaging and especially well received by these people, right? So I think that making sure that you're engaging leaders in every community to be able to get good information out to the population is important. Making sure that you are concentrating testing. So like, for example, here in the United States, a lot of the testing that's happening happens in medical facilities. So, some place in Midtown somewhere that's not necessarily accessible to everyone is doing the testing, right? That's not going to work when you're trying to prevent spread in a community that doesn't have access, right? So doing things to make sure that these people are being able to be
So it was like decentralizing the testing.
Absolutely. I mean, if you think about places that were actually able to flatten the curve, right? A number of Asian countries did screening and testing right in the communities. Here in New York City, we have subways everywhere. And we know that people are going to go through these subways, especially people who are essential workers having to go into work. They're not going to get in their car. They're all going to go to these centralized places. Could we not disseminate testing where we know that the people are? I think understanding your infrastructure and then disseminating information and testing in those places is going to be incredibly important.
Yeah. If you're just joining us, I am having a fascinating, insightful conversation with Dr. Ishira Blazer, who is our deep dive guest on this Wednesday, and the purpose of these conversations is to really go deep and to really try and understand what is happening here. So rather than a 5-minute conversation that you might see elsewhere, we try and have these conversations weekly with someone as accomplished as Dr. Blazer to really peel back the onion, if you will, really get down into the heart of the matter and what coronavirus means for us on the continent, what it means for Africans in the diaspora, and what the science is showing and where the gaps are in the knowledge. So thank you to everyone who's joined in. Let me just acknowledge everybody has been sending comments, Dr. Blaze, about how much they're enjoying this. Franklin Hiladbe says, very insightful conversation. Daniel Sesay, there's always a couple of Sesays in the house, is enjoying it also and saying good job. Adejo Victor David says, now the world is looking for COVID-19 vaccine. Apparently, he's also saying, please, I should push the endemic case of Lassa fever in Africa. I think to pause for a second on that comment, what's interesting about that and what should be highlighted, and you know this, Dr. Blazer, is even though we're all talking about coronavirus, there's still a host of other issues, other diseases that are still problematic for populations in Africa, and those still need to be fought at the same time as battling coronavirus.
Right. Yeah, and I think it's very interesting because there's been sort of a lag in the accumulation of cases in certain countries, and I'm wondering how much having the infrastructure, because there have been other viral outbreaks, has influenced that. So, in the United States, we didn't have screening of people coming off planes. We really didn't have the infrastructure we don't have isolation centers, anything like that, right? So I think it's sort of the blessing in that there have been other, infectious pandemics or epidemics on the continent, is that I think that in some ways, sub-Saharan African countries are a little bit better equipped to deal with this than some places in the West. In other ways, you're stretched very, very thin, right? Yeah. There's certainly still Lassa fever, there's still yellow fever, there's still, malaria. TB, right? So, and then I also think that diagnostically that has to be very difficult, because somebody comes in and they have a fever and a cough and some body aches and some diarrhea, and you're thinking this could be one of any number of things, right?
Exactly. Yeah. You talked about diagnostics. Why is testing so difficult? I mean, forget about access to the kits. You get the kits, and still the whole thing of testing seems difficult. False positives, false negatives. Talk to me about the situation with the testing.
Yeah. So the testing is really, there are biologic reasons why it's difficult. There are also political reasons why it has been difficult. We put the test into two camps, right? There are tests that detect virus, so that's a viral PCR, and that answers the question, am I infected right now? Mm-hmm. There are tests that detect antibodies, so that means draw some blood and determine, has my immune system responded to this virus before? So on the side of the am I infected now viral PCR test, this is the nasal swab that you use, take it to a lab, be able to identify the genetic material related to the virus. Now, the other thing to think about is that there's a difference between having a virus, viral infection and the virus replicating inside of you, and having a syndrome, so being ill with the virus, right? So think HIV, right? There are a lot of people who have HIV who don't have AIDS, right? But those people might still spread the virus. So it's same with any viral infection, including this viral infection. So when you're doing the viral PCR test, there has to be a certain amount of virus present for the test to be able to detect it. So some people who are not having symptoms don't have symptoms because the virus hasn't really taken hold and replicated very well, right? So now you go to test that person, that test may or may not be positive. So we get a lot of false positives, especially during the asymptomatic period, but it doesn't necessarily mean that that person can spread the virus to someone else. Yeah. With regard to the serologic testing, I think that because in order to identify antibodies, you have to answer 3 different questions. You have to answer, are there antibodies present? How much antibody is there? And what kind of antibodies are there? What are they doing? Are they neutralizing the virus? What are they doing, right? The easiest, cheapest tests to make are the do you have antibodies present? They work kind of like a pregnancy test. It's like a yes, no, right? Mm-hmm. That doesn't give us a lot of information as to whether or not that person is actually immune to the virus. And you can get false positives because there are other coronaviruses, right? There are other things that might look like an antibody to this coronavirus that are not. So I think getting the more sophisticated tests is a process, and I don't think we're there yet. And also, I think there are a ton of, the specificity for these tests isn't the best at the moment.
Wow. Okay. So there are alternatives, at least it's my understanding, to that PCR test, which currently is a nasal swab that you see them sticking that long thing down your nose and into your throat. There's the saliva test as well. How reliable is that?
Yeah, so I think that the saliva test has similar problems. And honestly, I do worry. So you have to get the virus where it lives. We know that this virus comes into our bodies through the nasopharynx, which is where the nasal passage meets the windpipe, right? Sort of like in the back of your throat. And that's where it's going to first start to replicate. Now, your oral cavity, your mouth, where you're making the saliva, is in very close proximity. And if you're making enough virus and you provide a saliva sample, perhaps it could be positive. But again, you have to have enough virus in that space in order for it to be positive, to have a positive test. So, even with the nasal swabs, we are finding that about 2/3 of people who took the test and had the virus tested positive, the other third tested negative. Mm-hmm. So, I think that all of these are subject to some rate of false positivity, and we just need more sensitive tests.
I do want to ask you a question that Adejo Victor David sent in. They want to know if there's a threshold of viral load that triggers symptoms.
Yeah, so likely, but it's probably different for different people. Mm-hmm. So, the incubation period for this virus is anywhere between 2 and 11 days on average. So that means, given that I have been exposed to this virus and it's starting to replicate in my system, it's going to take me about 2 to 11 days to develop symptoms. We know during that time period, more and more and more and more virus becomes present. So that means that likely the people who are more symptomatic are going to have a higher viral load and then more likely to test positive. I've taken care of patients in the hospital who were admitted they had symptoms that we thought suggested that they had COVID-19, and they tested negative in the beginning. And then they start to get sicker, and we test them again, and they tested positive. So certainly there's a relationship between viral load and development of symptoms.
Mm-hmm. There are questions coming in, and I want to try and get them to you before we move on. Isaac Kyle asked, why can't they use blood from an arm test? Why can't they detect this from blood?
Yeah, so again, you have to get the virus where it lives. So this virus, we don't believe, is circulating in blood. There have been some autopsies done on patients who have the virus. So we know that it's in the nasal pharynx. Certain tissues, actually fat tissues, the virus will live in fat tissues, kidney tissues. But we're not seeing a lot of virus in the blood of patients who are infected. So if you're looking for actual viral particles, viral genetic material, you're not going to find it in the blood. That said, antibodies are going to be in the blood. So, being able to determine whether or not someone's immune system has seen this virus and responded is something that you can do with a blood sample. That doesn't give you information about a current infection.
Okay. This one from Saida Soiree, what's the incubation period for an asymptomatic person?
Yeah, so an asymptomatic person, I guess, when we talk about incubation periods, we mean time from infection to development of symptoms. Mm-hmm. And so when you say an asymptomatic person, there wouldn't necessarily be, right?
Yeah, because they never show the symptoms.
Sure, but but how long?
How long are they infectious, I think is the question.
Sure. Yeah, and I think that is a huge question. We think about 21 days. So the longest time, when we look at case series, people who have become infected, people will shed virus. So when we say shedding virus, what we mean is how long can we detect the virus present, when we swab you and test. 21 to 24 days or sort of the longest time periods. After that, you're probably okay. We say on average 14 days. So for example, if somebody's trying to go back to work after an infection, we say, 14 days after last symptoms is when we absolutely think that you're less likely to be able to infect other people. That is a moving target, and I think we're learning more and more about the virus, but those are the best estimates.
As we wrap up, and I want to say thank you to everyone that has sent in questions, Adejo, Kyle, everyone that's Saida Soiree, everyone, Abdullah Salam, who says you're super intelligent. Yes, you are, Dr. Blazer. Everyone that has written in and has enjoyed this conversation, thank you. And Dr. Blazer, before I let you go, can I just ask you about masks? Can you just once more explain why it is important to wear these masks as being recommended by the World Health Organization and governments all around the world?
Absolutely. And I'm so glad you asked this question because there's so much confusion about it. We have to understand that probably most of the viral spread comes from people who do not have symptoms. So, and we talked briefly about viral replication or viral mutation and how viruses change over time, right? So a virus needs a human being in order to live, right? And viruses want to live. Well, the reason why viruses that jump from one species to another tend to be the most problematic is because they've never encountered this new species, and so they don't know how to make sure that their host lives, right? But a virus is going to live the best if it can spread without being detected, if it doesn't kill the host and the host doesn't have a whole lot of symptoms, right? And so what these masks do is you put them over your face, and any sort of droplet that you might be able to spew, like any cough, breathing too hard, coughing, laughing, is going to be captured by the mask. So you're less likely to spread it to somebody else. So the mask is like covering your mouth at all times. You assume that you have it and you're asymptomatic, and you don't want to spread it to other people. A lot of people think that the mask is actually to protect them, and it's not. It's to protect other people, right? There is some level of protection that you get, so about 20-30% reduced likelihood of getting it if you're wearing just like a cloth mask or, you know, a standard surgical mask. Now, when you get into like the N95 masks or like the medical grade masks, you're actually protecting yourself because you're filtering out the particles that might contain virus. But the idea that everyone should wear some sort of face covering is actually to decrease the amount of virus that we're transmitting to other people.
Dr. Glazer, it has been such a pleasure. We are so lucky to have had you for the last 45 minutes just to go deep in this and understand the science. I know that everybody watching really does appreciate it. I want to say a huge thank you for your expertise and being so generous with your time. Thank you. Thank you so much. I hope you'll come back in a couple of weeks and do another session with us, because we want to give people, you know, across the continent, across the world, the opportunity to ask their questions. So I hope you'll come back.
Absolutely, absolutely. And I really enjoyed being able to talk.
Thank you. Thank you. Please be safe. Take care.
You as well. Thank you.
And I want to say thank you to everybody who wrote in and shared their questions and just, you know, is paying attention to the science and doing everything that we need to keep our loved ones and ourselves safe. So thank you for being with me for that conversation. Before we go, you may remember that yesterday I told you that we were going to have Jackie appear on the Instagram show, The Bright Side. We thought we'd bring you some of that as well, because they're heavy. There's a lot that we're processing. And we here on Home with Isha Sesay believe that we have to hold on to our joy, our humanity, and have conversations with people that are also uplifting, because that's important to get through this. And we will get through it. We don't know when, but we will get through it. So we have these bright side conversations with guests every day on Instagram to kind of get a sense of how they're doing. And yesterday it was with Jackie Appiah. It was a super fun conversation. We want to bring some of it to you here, or whether you're watching on Facebook, Twitter, or YouTube. We want to share that with you here now, and hopefully we can bring a smile to your face. Take a look.
Hi.
Hi.
How are you?
I'm good. How are you?
I am very, very well. Welcome to The Bright Side.
Thank you. Thank you for having me.
Look at your fans swelling up the numbers. The moment you appeared, they were like, Jackie's in the house. Jackie's in the house. Look at your fans. It's just like, she's here. Royalty is here.
Oh, that's nice.
How's your day been?
My day's been okay. Been home all day, just resting, you know. Yeah, basically.
Are you bored yet?
I'm used to being bored now. I'm used to being bored now. So it's okay. I wake up, watch movies, you know.
And then just, so before this happened, what was a typical day like for you?
Wow, before this happened, I was working like on set, traveling from here to there, you know, going on different types of meetings, filming here and there, traveling up and down, you know.
You're
And now
constantly on the move.
I'm constantly on the move, constantly, you know, and I'm never at home. I am never at home. So during the lockdown, my sister will come downstairs and she'll see me in the same spot. I usually sit on this chair. She'll go and sleep and come back, and I'm still at the same spot. She's like, "Hey, Jackie, so you pa see how Corona has made you sit at home for once."
This must be so weird for you. I mean, are you enjoying any part of being at home more?
Yes.
Don't lie, Jackie. Don't lie.
It was a bit stressful in the beginning, especially when they locked us down, and that I can't travel anymore because I love to travel. People don't know, but I just love to travel.
But where do you love to go?
Anywhere beautiful. I like to explore different places.
Like
you know?
where? Tell us. Where's your favorite place?
I love London. I love Paris.
Ghanaians love London. What is that about? Ghanaians love London.
Maybe because of their fashion, the tax refund you get. you know, I love going to exotic places. I don't know, South Africa.
So you're a traveler. Are you a good packer? I mean, have you, because someone who travels this much, have you been able to master the art of packing? So if I said to you, Jackie, we're going now, could you pack in 15 minutes?
I can't pack in 15 minutes. I'm not a good packer. I hate packing. That's the part I hate. That's the part.
Do you pack like acting royalty? Do you pack like 4
Yes,
suitcases?
I need to pack. What I pack is, so if I'm going for 5 days, I need an outfit for what I'm going to wear on Monday, what I'm going to wear on Tuesday.
You're not serious.
Because I love to take pictures. I'm like, okay, I'm going to take this picture and take that picture. So I have to pack Monday. I need to know what I'm going to wear when I travel. So, and I hate folding clothes into my bags. I hate grabbing my sponge, having to grab. Oh, I hate it.
So I'm fascinated by, I mean, people like you who, I mean, let's be honest, I'm known to travel with like 2 suitcases, but that's the most, I think that's the greatest number of cases I've traveled with. How many? But something tells me you pack more than 2 cases. I just have this feeling about you.
Oh, no, you see, let me tell you. So when I'm traveling, when I'm leaving my house out of the car, I go with 2 suitcases. But when I'm coming back, I come with 6, 5.
Okay, so is there a pressure that comes, I mean, and the reason I'm asking this is I'm leading up to something, in case people are wondering. Is there a pressure that comes with being an actress? I mean, forget being in the public eye, being an actress and, you know, Gollywood, Nollywood. I mean, it feels from the outside, it feels kind of competitive, pressured. I mean, how much is that on your mind? I mean, how conscious are you so that you always have to look a certain way, appear a certain way? I mean, talk to me about that.
Yeah, it does put a little bit of amount of pressure on us sometimes, because sometimes you go somewhere, you're not in the mood of making up or looking all glamorous, and someone comes to you and say, "Can you take a picture?" And that one picture you take can go everywhere, can go viral, you know. And you don't want to see yourself looking awful in a picture. Sometimes you're not in a good mood, and then people approach you, and you have to be nice. You know, I can have a terrible headache, and I would have to smile and pretend as if there's nothing wrong with me when I'm crying deep inside me, you know, so having to always put up a smile to, you know, because these are your fans and they don't expect you to have bad moments. They always expect you
and they love you. I mean, it comes from a place of love.
Yes. So you have to always try and as much as possible to be nice at all times and appear nice. Yeah.
Is there some relief that comes from being at home at this moment in time, in the sense that social media, you can actually take a step back from social media a little bit? Is it a relief? Because when you're out and people see you, they're snapping. When you're out, you have to keep feeding the beast that is social media. Is it at least you get some pleasure from the fact that you don't have to do as much right now?
Yes. But naturally, I'm someone who likes to take pictures already, you know.
Oh.
So I'm a bit sad that I can't wear my nice outfit and take a picture anymore, you know. I'm sad. I'm like, oh. I have outfits given to me by people, fashion designers, and they're like, Jackie, you haven't worn my outfit yet. I say, yes, because there's nowhere to go to. Do you want to just dress up and take a picture? That kind of outfit, I need to be going somewhere in order to wear your outfit and then take a picture. You know, so but it's a bit of a relief, you know. But then now we're not taking pictures, we're not posting stuff that much on Instagram. What we're doing now is TikTok. So you do you do videos on TikTok.
I saw you doing one the other day where I think you were typing. I forgot the caption. Like,
yes, that unbothered, unbothered receptionist at the counter who doesn't care when you're dying. Yes.
When did you first know that you wanted to become an actress? And is this what you've always wanted to do?
In the beginning, I had always wanted to become a lawyer. I always thought I was going to be a lawyer, yes, because I guess I come from a family of lawyers. My dad, side, his brothers, all of them were lawyers, so I think I had that blood in me. But as a kid, honestly, I did want to act. I remember when I was young and they were showing Barney on TV. This is back in Canada. They were showing Barney on TV. And
in the purple dinosaur Barney?
Yeah, the purple, yes.
Okay.
So this is a long time ago. And I was young then, and they were showing it, and I told my mom that at the end they wrote, if you want to be part of the audience, call this number. So we called, and they said the filming was taking place in New York. So I was like, oh, it's not going to be possible for me to go. But as a child then, I can't remember how old I was, but I knew I wanted to be on television. I wanted to act, you know. Yeah, so, but I always used to take part in school dramas, part in the church plays.
Do you know what it was? Do you remember, do you get a certain feeling when you act? What is it that draws you to it, to performance?
The love for the act, the passion. I just love to act, you know. Back, like when I was growing up as an actor, I didn't care if I was being paid or not. I just wanted to be on set. I just loved to be with actors. You know, I just enjoyed acting. And I didn't care if you were paying me or not. I just wanted to be on television to act. I had love for the job. You know, I had love for the job.
Do you love it still? Do you love it with the same intensity?
Of course, I love it. I love acting.
Do you have a particular type of character you enjoy playing? And are there any types of roles that you would not take?
I like playing some of the roles I want to play. I usually don't get those roles. Like sometimes I want to play a gangster, but I haven't gotten that. I think I've probably got that once.
You're too pretty to be a gangster.
You know, I wanted to play a tomboy, but I was able to. They gave me a role as a tomboy. That was nice. Called Salah. Yeah, I played a tomboy. You know,
I can't see you as a tomboy. Were you a good tomboy?
Yes, I was good. Very scruffy. Very scruffy. I was a footballer.
Okay.
I was a footballer.
So typically, I can't see any of this, by the way, right now. I can't see you scruffy. I can't imagine you as a tomboy. So typically,
and that's the amazing thing about it.
What? Oh, that's
when you don't see me, so people had not seen me. People could not picture me as a tomboy, as a footballer. So when they premiered that film, like there were so many people that night at this theater. You know, there was a Kasum Scenario production, and there were so many people who came to watch. And yes, they liked it. They liked it. Wow. I got an award for that movie as well. Yes.
How important is that connection with your fans? And do you ever worry about the film roles you take that maybe your fans won't like them, or how much?
I notice my fans don't like when I get all lovey-dovey and like character, like when the guy is touching me, they don't like it. Sometimes, like there was once I was in a cinema and there was supposed to be this kissing scene where the guy was getting close and he was touching me. No, don't touch her, don't touch her, don't touch her, don't touch her, leave her alone, leave her, don't touch her. So I noticed my fans don't like when guys touch me on screen. They're very protective over me.
Oh my God.
Yes.
How comfortable are you with, you know, romantic scenes to whatever extent they are on screen? How comfortable are you playing those roles in those moments? Because some actresses don't do them. How do you feel?
Yeah. I don't do them too. I won't go nude. You know, And then now there's camera tricks and there's the power of editing, so we can make the kissing scene look believable when we're not actually kissing,
Oh, wow.
The power of editing, yes, sometimes. So, yes.
So do you not kiss for money on camera?
No, some actors can say, okay, fine, I feel like kissing, I want to kiss. And then the other actors who say, no, I don't want to kiss. So you have to make it look believable. Yeah. And then it's the power of editing.
What, in your opinion, makes a great actor?
Someone who brings the character to life, lives the character. And I love acting with extremely talented actors, because when you're acting with extremely talented actors, it brings out the good actress in you. I hate acting with crappy actors because then they bring your spirit down. But once you give me a good actor, it would help me bring out the good, like the actress in me. So yes, making your character believable.
What's your message of hope, inspiration to your fans, that everybody's watching? What words you want to leave them with as we bring this to a close?
We all know the times we're in right now. I think God has humbled all of us right now. He's given us time to reflect, learn from your mistakes, spend time with your family as well. Do things that you've never done, cook. If you haven't cooked, learn how to cook. But most importantly, you should please stay at home as much as possible. If you don't have anything to do outside, please do not go out. When you're going out, please wear your mask. Wash your hands as much as possible for like at least 20 seconds under running water. Also, yeah, just keep safe. Try as much as possible not to touch your face. I'm someone who touches my face a lot.
Me too. You see, I'm always.
I touch my face all the time. I don't know. I'm gonna do this, but I'm like, oh, don't touch your face, But it's very hard. But if you don't have water, make sure you have sanitizer with you. Please keep safe. Stay out of trouble. I love you all. Thank you for supporting me. Thank you for tuning in tonight. I love you. I love you. I love you. I love you all.
And we love Jackie Appiah too. Actress Jackie Appiah, one of Ghana's finest actresses, and she received so much love during that conversation yesterday on Instagram, and we thought we'd share some of that with you. Just to reiterate what she said, please stay home, please stay safe, please maintain the social distancing guidelines and wash your hands as often as you can. So important that you do that. That does it for us here today on Home with Isha Sesay. I'll be back tomorrow with a brand new show, more great guests, more in-depth conversations, and of course we will be taking a close look at what this pandemic means for us in Africa, how it's impacting life, what it means for Africans in the diaspora. We'll have it all for you once more tomorrow on Home with Isha Sesay. I do hope that you will join me here. Mark it down somewhere. Don't be late. I'll be back here, same time, same place. Please stay safe, everyone. This virus is serious. It is real, and we need to do our best to protect ourselves. Hope to see you here tomorrow. Take care. Bye for now.